This is CareShift with me, Safik Bilikanti, and I'm so excited about our guest today. Matthias Hofmann is the co-founder of Eyebot, a company transforming how eye care is delivered by bringing 90-second AI-powered vision testing and doctor-verified prescriptions to everyday locations like malls, universities, retail stores, and grocery chains. Eyebot's innovative self-serve kiosks eliminate long wait times and traditional barriers to vision care, making accurate eyewear prescriptions accessible to millions of people across the United States. Eyebot has raised over $30 million in venture funding from General Catalyst, AliCorp, and Ubiquity Ventures, and is rapidly scaling access to vision care across the United States. Matthias, it's amazing to have you on. So thank you for being here today.
Thanks for having me.
Was there any single moment or insight that convinced you that, automated vision or is going to become like a public health, lever? Like what is there any pushes that kind of got you into this field overall?
Yeah, I mean, it goes all the way back, I'd say about 11 years. At the time, I used to work at a company that was doing the first smartphone-based vision testing. So, at the time, 2013 or so, it was an exciting time where on a sudden smartphone-based exams or vision testing really became a thing. And we were working on the first solutions that went to market on that. But really, I very quickly learned about the bigger problem of the vision care industry or the eye care industry. And, we saw, especially in our testing, we saw so many patients and so many folks that were in really like in a neglect state of having not checked their eyes in 5 years, 10 years, or never really. And these are folks from like all walks of life, from 20-year-olds all the way to 65-year-olds or older who have never had eye exams, right? And how is that even possible in the United States, a first world country, right? And so that was really eye-opening to me I guess no pun intended, but it was really eye-opening that there's just so much need out there, so much demand out there for eye care. But the hurdles to getting the eyes checked are so tremendously high. Something like around 50% of Americans are don't have vision insurance or have no managed vision care, and oftentimes in the United States, your insurance depends on your employment status. Depending on the quality of your employer, you may or may not have vision insurance. This is CDC data. The lower third of income level in the United States is half as likely to go to see a doctor. And so, looking at all these facts, something like 8 million Americans are not wearing glasses, even though they should wear glasses. Another 8 million Americans are just not wearing glasses because they can't afford them. How is that possible, right? A commodity item like eyeglasses, as important as having a pair of shoes, and people are choosing not to get it because they just can't find the time or have the money to get it. And so these numbers were true back then, 11 years ago, and they're still true today. In fact, it's actually getting worse. So there's actually less doctors today available than even just a few years ago. And actually that decrease in doctors, the net essentially gap of doctors is growing. So I think in about 10 years, there will be 30%, the gap of ophthalmologists. So those are the medical school trained eye doctors. That gap is going to grow by 30% more. So there's more ophthalmologists retiring today and also in 10 years than they're coming out of school. And a similar kind of statistic is happening also in the world of optometry. So there are far more jobs open per year than students coming out of school.
Because of that, it's so cool to think about. I had vision problems ever since I was 13. I had glasses now I have contacts. But one thing I wanted to kind of understand is, to be blunt, if I notice any vision changes, wouldn't I be able to want to go to a doctor, right? Or to an optometrist and kind of get my vision changed? What is like the normal American or normal person not having reluctancy towards getting an eye check? Like, what are those biggest barriers?
Well, the barriers there's a couple of barriers. The main ones that you can cite are really cost and convenience, and also, frankly, geographic luck. Do you live near a doctor? And in inner city areas, there may be, of course, more doctors, but then also the amount of demand that these doctors have, typically they're fully booked out for months, right? Or you can be in a rural area. There's just no eye doctor, no eye care provider within 20, 30 miles from you. And 25% of U.S. counties do not have a single eye doctor.
Wow.
Yeah, of course, those are more rural areas, but still, those folks also need to check their eyes. And that's why really it's our mission to partner with companies that have retail locations in those areas, but they're also lacking doctors and struggling to find doctors.
Right. And so when it comes to iBot specifically, what were those specific lessons you learned from those early kiosk
Mhm.
deployments in specific locations? And what were the key takeaways?
Yeah, I mean the lot of surprising results. So when we started this, we really just wanted to first, from a product standpoint, explore what will be a user interface where people can would check their eyes with very little instruction or help needed to be able to do that very quickly or be able to get the measurements very quickly. And what kind of interface is that? So we actually very early on was like, well, maybe it's actually a kiosk because then you can create a product that and a service that works for the vast majority of people, folks that are in their early stages of life, all the way to the late stages of life, standing, sitting in a wheelchair. We want to be able to make something that is inclusive for a very broad spectrum of people, people that understand technology, people that understand nothing about technology, people that are educated or uneducated or rich or poor. It doesn't matter. Some a configuration or an interface that just works for everybody. That was from the very beginning goal. And so we focused on the interface first. We built the first versions. We put them in shopping centers. And some of the surprising results were we put up a sign that says free vision test. We offer it for free and give information to people for free. And we wanted to just learn, who are we capturing? And the answer is, and this, I still get goosebump moments for thinking about this, is how it's not just a certain type of certain age group. It's everybody. We're talking like, you know, 18-year-old to 70-year-old, the same distribution across all age groups, across all income levels, and all races, Black, white, Latino, Asian. We see it all. And we see, like, when we put the first units out there, the folks that were using it, it was a complete sort of like multi-spectrum, multi-color, multi-ethnic, everything at the same time, Americans and foreigners and everything. And it was just like this eye-opening moment for us, showing that, folks with high income or they're 50 years old who have never had an eye exam in their life.
And I think
Mhm.
one of the biggest questions is, how did you kind of get your first deployment? What was your first testing criteria? You mentioned you set up a free vision test. Like, how did you get that set up? Did you have to go through any partnerships? What was that process like?
Yeah. So the first deployments we did without any partnerships. Really, to us, it was more proving to ourselves that we have a configuration and that our interface makes sense. So really, our first testing wasn't about money at all. It was about proving that the product, people can use the product and people can use the service, and are finding benefit from it. Right. That was the number one thing before we even cared or thought so much about business model, because we want to prove that we have something that people can use and is beneficial to them. Period. The money, like the business model, you can figure out later. But that was the number one thing. So we did that. And so once we had that proof and it was very clear that we had something that a lot of people cared about. And so then we were able to raise our first money from venture capital to help build the company. Actually, before that, we actually got National Science Foundation grants. So that was how we actually started the company. So through grants from the government and the National Science Foundation.
Yeah. So with, these kind of kiosks kind of locations, it's so cool to think about. Can you kind of walk through the science of how it works specifically?
Yeah. So in short, the current S1 Plus platform, what it does is it does four things. So there's an intake questionnaire at the beginning that really simulates a lot of what happens in a doctor's clinic when you have that conversation about your health history, about your eye history, your age, and any preferences that you have on your glasses, for example. And knowing that, and then you go into what's called a visual acuity test. So it's a kind of a letter test to get your best correct visual acuity. It's not too long, about a minute of your time. And then we go to what's called auto refraction. So we can scan to extract the prescription from your eyes. And we do that with safe infrared light, meaning that you don't have to stick your head into a machine. You just stand there casually and comfortably and look at a balloon. Most people are familiar with a balloon or a barn door or a barn that you look at. And then the last part is if you have glasses, we also scan your existing glasses. So there's a tray where you can put your existing glasses in there. We also analyze those to see what you were used to wearing. All that information It gets checked and then goes to our doctor portal, which then essentially is as like an EMR. It's like a platform where our teledoctors can review all that session information. And then they use their clinical training to make a recommendation. And if they recommend a prescription, then they can, using their judgment, after prescription. And then that final prescription gets sent back to the user.
And what does that whole process look like, getting the results back to the user?
Yeah. So if their user is eligible and the doctor deems that they can have an updated prescription, then the doctor signs it, and then Eyebot then delivers that prescription to the customer, to the user via email.
Very cool.
There's other delivery methods we have as well. For example, in stores, we also allow the user to opt into a fax delivery, or like a print delivery, so it can get printed directly into the store.
Right. What were the biggest hiccups that you guys had at first, kind of implementing these kind of stores? It looks like, based on what you're saying, it was really very successful when you guys first started, but were there any hiccups that you guys saw?
Um, Well, so it's a combination of hardware and software, and that's always hard because software development usually runs a lot faster than hardware development. And yeah, and we've gone through many iterations on this product, on the hardware itself and the software that runs it. I think we're in generation 8 at this point, and it's constant refinement. We actually, I would say, the biggest hurdle was clinical testing and the clinical studies that had to go into it to even be able to put something on the market. Right, so that was a very substantial amount of work that went into it before even we could even activate.
So when you guys started seeing this initial traction of so many people using it, which is amazing, and then you guys kind of got your first venture capital, what was the common marketing strategies that you guys used to kind of get people to use it more? And what was the business models that you guys started off with?
Yeah, the marketing was simple as put up a sign and let people just naturally walk into it. So put it into high traffic areas or stores, and so far that's worked out great for us. That's really all the marketing there is.
Yeah, and that's so interesting to think about because I mean, I feel like vision is such a interesting thing because, there's so many kind of different diseases that can go along with it and so many different types of, obviously people have different types of vision changes and things like that. So how did you guys put those into account as well? Like, can you guys help with detecting diseases, or is that something that you guys are getting into in the future?
Yeah, what I can reveal today is that we are focused on the prescription right now, but we have some pretty exciting things in the pipeline for anterior, posterior segment screening as well. And I won't reveal any timelines on that yet. But the point here is that there's a lot of opportunity to capture people out there that are in dire need to actually get their eyes checked and are completely neglected or have neglected it themselves knowingly or even unknowingly. And we want to be able to send those folks to as quickly as possible to the in-person care and doctors. What we also found is, besides if you're eligible, being able to get a prescription very efficiently and in a timely manner, we're also a very good triaging machine, meaning that our doctors, not actually Eyebot, but like our doctors, when they review these sessions, can screen out people that have clearly or may indicate that there's some sort of issue with their eyes, and then our doctors then refer these users to in-person care. And so it's not just a prescription solution; it's a screening and triaging solution as well. That's actually been very interesting for retailers to also have.
So what were the current lessons that you guys kind of learned so far, kind of going to go to market to like larger locations, the Costco's, Sam's Clubs, how has that been overall? And what does that timeline look like that you can reveal, obviously, for like 2026 and on?
I mean, in general, our approach has been to speak with a lot of the larger corporations. I think that's pretty obvious as we are rolling out. But we have numerous tests as well done in the past and are in process of doing with individual clinics and stores as well. And there are multiple channels that we're interested in. That includes hospital, urgent care, public locations like shopping centers and schools, and from primary schools to colleges. We've done some really successful tests at colleges and all the way through optical retail. And then really, when you realize that when you have such an accessible platform, you realize actually you can provide these kind of vision care screening and services in a lot of places. That includes airports, that includes grocery and locations that people go to already. And that's what's exciting to us.
What I think of immediately is the blood pressure cuffs, right? In like Walmart and then, grocery stores. We see it all the time. And it makes complete sense that why can't that kind of be a more transformable area for vision tests as well and things like that, and that kind of makes a lot of sense. In that kind of category though, is that the vision of what you guys are looking like kind of be in like near like almost every grocery store, airport to kind of give more accessible vision? Like, what does the complete vision look like for Eyebot?
Yeah. So long term, we want people to be able to check their eyes and get information with as little hurdle as possible. So if we help people find a certain condition or something of concern, and then they end up in a comprehensive eye exam with a doctor, to us that's a huge win. And there's just so many folks out there that are behind on checking their eyes, and so yeah, that's really a big goal of ours. On top of that, of course, if they're eligible for an eyeglass prescription, people should be able to buy glasses in a timely manner. Why does something like as essential as a pair of glasses take weeks to months for people to get? That just doesn't make sense. Like if you can do that in 10 minutes, and we see so many folks at our Walmart locations. They have broken glasses or scratched lenses. They should not have to wait 4 weeks or 5 weeks to get a new pair of glasses. It just makes no sense. And so, in our mind, there should be an alternative path. As you may know, today, effectively, there's only one path to get, or one main path to get to an eyeglass prescription. That is through a comprehensive eye exam. But that does not make sense for everybody. For somebody that broke the glasses, for somebody that has scratched lenses, or for somebody that lost their contact lenses, why can't we just get that solved right away so people can see clearly again? And so that's really, we want to provide an alternative path for people. And we feel that consumers deserve it.
That makes a lot of sense. And then, with that, has there been any advice that you can kind of give or recommend to founders that are trying to, that are building in software or hardware that, when it comes to go to market and kind of the best way to experiment with that
I
overall?
would say, yeah, it's one step at a time, right? Like, don't building a startup takes way longer than you think. And there's actually something beautiful about going into it with a certain, like, being naive and thinking, yeah, we're going to conquer this thing in just a matter of time. Like in 2 years, we got it, or 3 years. You kind of have to go in kind of dumb like that because you in sort of blind. Otherwise, if you knew the amount of work required to even get off the ground, I think most people would just not even start. And so it requires that sort of optimism and just to keep pushing. And so I think what keeps many of the startup founders going that seem to be doing well is by making a very achievable goal, maybe just 10%, 20% too far, but trying to get there. Once you're there, you're going to set a new goal, right? But you just keep doing that for years and years until one day you look back and you're like, actually, we did some pretty good work, and we're somewhere that I can be proud of. So
Yeah. And would you say that for iBot that has been achieved where like you're at the point where you kind of feel like, oh my goodness, like looking back, I'm like surprised we're here now? Or is it like, okay, we have a lot to
yeah,
do?
like we still feel like we're at the beginning. There are 8 billion people on this planet, and something like a quarter of the or a fifth of the world's population is undercorrected with glasses. So we clearly haven't achieved our goal yet. And so that's the high level goal, is that everybody should be able to access vision testing and then ultimately eye exams, and that should happen without really much cost or inconvenience, and that should happen around the world. But you can't just take over the world and solving that for the entire world. It's kind of like world hunger. You can't just like flip a switch and it's gone. So you have to solve one thing at a time. And right now we're focused on the US, and one day we'll also focus on Europe and South America. And then we keep going.
I actually, started a nonprofit about like, back when I was in high school because I had my own vision problems back then. Kind of serving and kind of giving glasses to a lot of people that can't afford it back in different other countries and things like that, where we kind of partnered with a lot of organizations, like a lot of nonprofit orgs that kind of work with ophthalmology overall and kind of donating glasses. And one thing I learned specifically, and I would love to get your take, is that I'll like literally, if you are living in like a terrible place, especially like for example, I'm from India. There's a lot of people that are in these like urban kind of village areas where they definitely need glasses, but they're like compensating so much because they can't afford it, and that could be possibly seen more often all over in other countries more than the US. Has that been kind of like the same take that you've seen overall, kind of talking to, people around the world, or like what has been your experience with that?
Yeah, I mean, there's so many. This is such a big problem to solve. I mean, like I said before, like something like 20% of the world's population does not have the glasses that they need. It's ridiculous. Something that, if you think about it, as a human species, we figured out how to solve poor vision through refractive error. Like it's called glasses. We can make these pieces of plastic very efficiently and very, very affordably. We've been able to manufacture, nowadays you can it's machines that just crank out the lenses, and it's called edging. So we can injection mold the frames. We can make all this for, I mean, most glasses, even acetate frames, the cost of goods to make that is less than $20, right?
Wow.
Yeah, and there are some specialty frames, of course, cost more, specialty lenses, sure. But the vast majority of glasses that get sold cost less than $20 to make. And you can even get some really affordable versions for like $5, right? Not saying that's the best quality, but the point is that being able to see better can be accomplished for very little dollars. But as a human species, we're still stuck doing a very rudimentary task, such as getting a new eyeglass settings in a very antiquated and traditional way, where you sit in a chair behind a machine called a phoropter, things that were invented 150, 200 years ago. And while that makes sense in many locations in the world, it's not going to scale with the demand. And so the only way to make up that gap is through automation.
Yeah, and in this case specifically, like, and I kind of wanted to kind of bring this up because you were kind of alluding to this before, was the concept of you guys working a lot with like specialty clinic areas, like Vision Works as an example. Like, how is that kind of partnership can come about? How can that happen? Specifically, where like like a patient can use you guys to get that prescription, go to Vision Works and kind of get the glasses. How would that whole system work overall?
When you build a business, you have to, of course, make sure that you have a for profit, a business that can
Yeah.
create profits eventually, so they can pay your employees. And so it's a sustainable business. And we've found that there's a very interesting business model where the retailer effectively pays us for our services, for because we have our own doctor network, we have our own platform, and it's got to get serviced, and it has to there's a whole software backend, and the operations is quite complex, and we can manage all of that. And so it's essentially a subscription service to put in your store. And that's gotten a lot of traction. And so that's really our business model, is that the retailer is our customer, and that allows them to serve their customers, their consumers more efficiently. And that's great for the consumer and for folks, because then they can get glasses without having to wait for months to be able to even get the pair of glasses. So it's a configuration that works out really well.
Yeah. Kind of talking about it as much as possible. How has the sales cycle been for you in your cases? Has it been kind of longer than expected? Kind of right out there? Like, what were those
It's right
steps?
there. Going into it, we didn't go in completely blind on what it takes to do enterprise sales. As you can imagine, like an individual location, it goes a lot quicker to like. A lot of it is about building relationships. So if you want to do a big enterprise, working with the Forbes 500, 100 companies, you're gonna need some patience. Just because these are big organizations, to have a lot more folks involved, and the decision making is just obviously not the same as when you're talking to Peter's Optical down the street, who is owned by Peter, and the only decision maker is Peter. So there's that dynamic that you have to deal with, and that's quite natural. You just have to be equipped for it, and you also have to make sure that your finances work out for that kind of long play that you have to do. That takes time.
So, why did you start iBot?
Really, our mission is to make vision care accessible to all equally, and the equally part is the big problem. Is that some folks that have easy access to glasses, or easy access to eye care, meanwhile, people that live in the same neighborhood or live in the same area have the completely opposite experience of not being able to afford glasses, not being able to afford exams. I don't have the time because I work in two jobs. Like, and these are people that are living next to each other, right? And we want to make eye care accessible equally. It's sort of what is the great equalizing solution, and that's what we've always been focused on.
If you could start Eyebot all over again, is there anything you would change?
We haven't made too many mistakes yet, but the thing is, like, of course, I would do things a lot differently if I knew what I knew today. But that's not how life works. If you already knew the outcome of certain things, then you could skip a lot of stuff. It's kind of like a chess game. If you already knew the outcome of the game, then of course you would do it differently. That's just not how life works. So I always encourage also our team and everyone to like learn from, I wouldn't even say mistakes, but from decisions made that didn't go the way you wanted them to go. But at the time, you should feel comfortable. If you feel like you've made decisions with given the information that you had at the time, you've made certain decisions with that information at the time, you should not feel bad about it because that's the information you had at the time to make those decisions. Where of course, you can improve things is synthesizing information differently or understanding your decision making abilities to like look out for certain risks or seeing around the corner that you couldn't see. But I think a lot of it, especially for startup founders, is about being able to see around corners, not only one corner, being able to see around two corners. That is probably I would say one of the big secrets to success.
How can you kind of, I guess, make as many errors as possible? Is there anything that you wish that you thought you knew?
Business mistakes are fine. That happens all the time. I think ta- there's there's quotes out there. I'm not very good at memorizing quotes, but one thing is true is that I think a lot of people overestimate the risk in certain business decisions. So, what if I do this and it doesn't work? Or what if I do that and it doesn't work from a business side? But there's so much you learn from just doing things that it's oftentimes better just to do it rather than just sitting on your butt at home and hoping something good is going to happen. Because that's definitely you basically have to kind of the more chances you have at rolling dice, eventually you're gonna get some sixes. And so I like to call it creating your own luck. And the more shots on goal you have, actually one is going to go in. And so that's how you should think about business and just taking risks. So I think a lot of times people don't do things because they feel like it's too risky. But I would say the risk is far lower than you might think.
I know you brought up a great segue point where I wanted to talk a lot about failure as a concept point here, where a lot of founders, especially in healthcare, where it's very, very difficult to get started. I mean, even when you do start, it is hard to keep going.
Yeah.
Is there any specific failure points that you've had along the iBot journey that you like? There's a specific example where you were like, I want to give up. I don't want to keep doing this. Like, has that ever came up before?
Yeah. So one of the things that we've observed is we wanted to know if people could get a test done and being able to purchase glasses online, sort of in the same configuration without having the hardware there, without seeing the glasses or without touching and feeling the glasses. And I think we went almost a step too far in terms of society being ready for something so digital or hybrid digital. And what happened then, while that didn't work the way we wanted, what we found was actually more valuable than them now. And that's what I'm saying is like there's always like sort of like a learning from it that you realize something even bigger is actually around the corner. And more specifically, we found that um, in general, most people need to have somebody around to be able to purchase glasses for somebody to get a consultation to get like, yeah, those look good on you, or like you should try this frame. There's a reason why 85% of the eyeglass market in the United States is in brick and mortar, is in stores. And a lot of that is rooted in people, society still being very used to going to stores to being able to get their glasses because of that sort of concierge relationship with the store is very important. And so that's one thing we learned, and it was not obvious when we started.
And a lot of founders that approach me kind of have this kind of thing of like how they can kind of most optimize conferences and things like that. What was your experience, like for example, at CES and things like that, where you guys have been? What was your best marketing strategies or kind of GTM motions for conferences that you have for most founders out there?
Be very clear about what you actually want to get out of the conference. Just going to the conference is not going to do you much. what is it actually that you want to get out of that conference? Is it leads? Is it partnerships? Is it visibility? Is it like that people talk about you? What is it actually that you want? Because if it's just leads, then you don't need to have a booth necessarily. Maybe actually just schedule meetings and schedule, or maybe make panels and schedule something, and you can probably get far more out of that than spending a lot of money on a booth. Or when people need a demo, does the demo need to happen on the show floor, or can you put the demo actually in a hotel room? Like, I'm just spitballing here, but like, it doesn't have to be exactly like by the book. And so uh, I think being very clear about what the goal is comes first, and then building towards that goal. And that's how we approach all our things. So including our CES, um, you know, rollouts as well.
And what have you learned kind of going to these conferences and kind of looking for leads or whatever your objective is? How has that kind of grown over time throughout iBot's journey?
It's always a depends on the time, right? Depends on where the stage the company is, and um, that depends. It depends on what you want to achieve as a company. Are you looking for investors? Are you looking for partners? Are you looking for leads for your business? There's many reasons you go to a conference.
So, as your team kind of grows, what were those kind of common hiring mistakes that you've made or you've seen done? And is there anything you regret on that side?
So I would say we've made very few mistakes on hiring. We're very thoughtful about who to hire. We have high requirements on persona and how they fit within the team. And, we've had very high retention because of it. We're a team that all works really well together. We have a no ego policy. No outsized egos allowed. You can leave that at home. I don't care what school you came from.
Mm.
I don't care what company you worked for in the past. Doesn't matter. Everybody's equal. And what we care about, of course, is your experience and what you're good at. And we don't really look at the resume too hard. But if you can show us that you've built this amazing thing, we're very interested. So we care more about the aptitude and the creativity that people have. And so that's how we've been hiring, and it's been very successful that way.
So, how did you kind of manage delegating tasks? Are you like someone that kind of tries to sit in on almost every meeting, or like do you kind of like comfortable with delegating tasks and comfortable with trusting people?
We very quickly and very early give people a lot of trust. And that sometimes shocks people a little bit. Um, we maybe you can call it like a sink or swim kind of approach, but we of course think early before we even hire the person if they can actually swim. But giving them a lot of responsibility immediately has actually worked for us out has worked out for us very well so far. Of course, like, it has to be relative. Like, you can't give a junior employee a task that typically like a C-level executive does, right? Like, that'll just not work. But we always try to spec a project that's about 20% above somebody's perceived abilities.
So, kind of going into a lot of the, future of eye care, what does that look like overall? Will there be more people just going to the clinic or like using kiosks? Like, what does that future look like?
Well, frankly, the demand for eye care is so big and growing that uh, no matter kiosk or not, or iBot being everywhere, the demand for doctors is not shrinking. So it's actually increasing. And so, the wait times will continue growing. Hopefully not too much, but we can hopefully help stem that. And really our vision is to be able to manage and take care of the folks that need immediate care to getting new glasses immediately. There should be a fast lane, so to speak, to getting new glasses if they're eligible. And there's no real risk of any underlying health condition. But also the people that we drive to comprehensive care will also drive more people to the doctor. So really we think of iBot as a multiplying force where we can triage people faster, earlier, and more efficiently. And that drives more high and critical cases to the doctors, and also essentially lifts everybody's boat. So the saying is like a rising tide lifts all boats.
Yeah. And, One kind of thing that a lot of founders have, and it makes complete sense in this current world, is like every time they're trying to build something in healthcare, for example, there's five other competitors that are doing something close to them. It's very, very crowded now in a lot of these different sectors. So, how do you guys kind of differentiate yourselves and kind of get cut through the noise and kind of do that through many other competitors out there that are potentially doing something like what you guys are doing?
Yeah, there's kind of some competitors out there. There's kiosk solutions out there. They're doing things differently. There's some other folks like they're trying to solve the prescription problem or even the accessible testing problem through other platforms, even online or and approaches. But we're quite confident that we have the right configuration and the right mix of all these things. There's not a tremendous amount of competition right now, but we do feel that that's not going to last for very long. The problem that we're solving is so big and vast that it's just a matter of time until it'll be flooded with competition.
And with that said, like, do you like stalk them or do you kind of let them do their own thing and kind of trying to like outwork them? What is your strategy there?
I don't think it's worth spending too much time worrying about the competition. Focus on your customers and your users and make them exceptionally happy. Be obsessed about making your users and your customers happy. And even if you tried everything and they didn't get what they wanted, you can still make them happy. There's focus on that. Focus on the customer success and happiness. Because if you do that, then you kind of have a business no matter what. Like just focus on it. And then the competition is there, will be there anyways. There's no like eye care, vision care is soon to be $100 billion market in the US alone. And you're not going to be alone doing that. Like,
That's
so yeah, of course, but there will be competition.
Well, do you envision kind of, especially in eye vision care, to be like one, like a king kind of thing, where there's like only one king, and then there's like a couple others in the bottom for when it comes to market, or will there be multiple players that are relatively with the same amount of market traction? Like, how does it? What do you think it'll look like in kind of vision?
I mean, we think that we have a pretty good head start. We've deliberately been sort of quiet about what we're building in public, just to make sure that we have all the gears and all the things, all the pieces in place, and timed our sort of public unveiling or public description of what we do in a very specific way.
Right.
Um,
Yeah, and beyond glasses prescriptions, I'm curious to know like what you think kiosks can do when it comes to preventative screening overall. Like, is there any big potential in other health standards that kiosks can potentially get into?
Yeah, actually, it's a great question because there's a saying that the eye is the window to your health. And because it's one of the few places where without cutting yourself, without cutting your skin or, your tissue, you can actually see blood vessels. You can have a direct access to your tissue in the back of your eye and blood vessels. So you can, with the right equipment, the right technology, you can actually screen for diabetes and other disorders that are more systemic disorders and diseases that people have. In certain cases, signs of cancer can be detected through an eye exam. So there's a ton of value in comprehensive eye care. Um, and I say this because I think the general public does not know this. If you ask the general public, what is an eye exam good for? They can probably list maybe one or two things. And typically it's about, I can get an eyeglass prescription. There's far more than an eye doctor does. Um, and there's so many health benefits to just checking your eyes regularly. And we will also have what I think a very unique opportunity at Eyebot to educate the public on the value of comprehensive care because when they're taking an eyeball test right then and there, they're very obviously thinking about their eyes. And so we have their mind is open, they're listening, and we have this opportunity to educate about the importance of comprehensive care.
Yeah, and that specifically, like, what does that look like in like 10 years from now? Like, what does a world with 100% vision care coverage look like in that sense when it
I
comes
mean, that
to?
would be a dream, right? Like 100% coverage,
Yeah.
but that's very aspirational. But we can try to move the numbers.
Yeah. I mean, what is the hardest part balancing? And you were kind of talking about this before, but what is the hardest part balancing hardware and software at the same time?
Yeah, the different rates of development, right? And then on top of that, especially when you're in a regulated environment, where you have to make sure it complies with numerous regulating bodies. That includes the FDA, that includes ADA, and I can list uh, a bunch of agencies that start with F. And so you have to do that, of course, and you have to like right size your development to what's necessary at the time. It's very hard, especially for inexperienced hardware designers, to either completely overshoot what you need to do or completely undershoot what you do. That's pretty common. That happens pretty often. What I'm actually seeing more is that a lot of folks overshoot the
Mm.
requirements that you need to do, simply because of inexperience. And if you don't know, you just do everything. Yeah, so that comes with experience, of course. That's hard.
Yeah.
So that's the hardware part, and actually with the software too, right? Like, cause cybersecurity, you got to do all that work too. Yeah, get good consultants that don't bleed you dry.
I mean, what has been the hard pushbacks from potential customers that you guys had to fix overall that you guys saw constantly and you guys changed or like are currently seeing?
It has more to do with customizations. Oftentimes, as you can imagine, certain customers or retailers, they want certain customizations. And so that can be managed. So those are things. But also just listening. I think that's a place where it's not taught in school how to build a startup, right? And if I could just tell every startup founder, just be obsessive about focusing on customer. Like, what is the customer saying? What are they saying? What are they frustrated about? Fix that. Like, build that. Not like the cool feature and widget that you've always wanted to build. And I fall into that too. Like, I luckily have a team that slows me down. And when I get like too excited about a certain new feature or addition or something nice to have, don't build, it's like the vitamins versus pills. Like, what is actually important? And so you have to be really thoughtful and obsessive about listening to what people are saying. And especially early on in my career, I would be kind of almost a little ignorant towards listening to feedback from users because it would almost hurt my ego when they like didn't like something, or like when they didn't like this product or this feature or something like that. In my mind, it would be like, how could you not like this? This is amazing. But no, that doesn't matter because ultimately you're building something for other people and they have to want it.
Yeah, no, I feel the exact same thing. I mean, when I first launched my MVP in kidney care, I mean, we got so much like negative feedback, and it definitely hurt me. Like, it hurt my ego at first, where it's like, how could you not like build this? This is not even in the market,
Yeah.
And it's
Yeah.
like something like how like what is wrong with what we're building? But then I soon came to understand like they're saying it for the good, right? Like if
Yeah.
it's not
Yeah. Yeah. They want
like
you to succeed and just listen. And
right, right, and that's the truth. I think that's the biggest truth there, and
yeah.
you know, I kind of going to like the kind of investing kind of side of stuff. What were those first investing hurdles like, if you had any?
I would, I mean, I can do a whole hour on how to raise money, but I'm very opinionated about it too, because I did learn some things that work and don't work, and I would definitely redo things or do things differently if I were to start over. But again, I didn't know at the time, so I can't blame myself too hard. It's all like a journey of growth. But really, I would say the key thing, especially when you're looking at pre-seed or seed type of investing, like these kinds of investors, they're really looking for three things, and everybody's going to quote something differently, but this is what I would say are the three most important things. And you're going to notice that none of them actually have to do with the product. So the first thing is, are you solving a huge problem? And I mean, massive problem. Not like, oh, this kind of sucks. Let's solve that. Like, I'm talking, I can explain in one sentence what we're solving, right? And now it doesn't have to be that obvious. It can be like some really complicated server infrastructure problem that somebody's solving, but it should be obvious that is a massive thing that needs to be solved. And that's number one. Number two is, why you? Like, why are you the one that's going to solve this thing? If you can't answer that, like, what's special about you that makes you the one that's going to solve that problem? And how many others of you are there? And if there's only like 10 on this planet, that's pretty good. Because then it really means that you are at the forefront of solving this massive problem. And only you and maybe a handful of other people that you may already know can actually solve this thing. And that's going to get that's definitely going to get investors interested. And then of course the third thing is, you know, well, do you have a good solution to solving that problem? And is that, is the the business model actually, or not even the business model, is the product going to service, or the service, is that product or service going to solve that big issue, or can it address that big issue? That's I would say, the three most important things. But how exactly you build that product and the features are not part of the equation here.
And you've had a pretty well kind of good cap table when it comes to you guys had General Catalyst on your cap table and things like that. What have you guys learned from GC as a whole? Were there any strengths from working with them that you think that versus other maybe competitors who don't have them on their cap table? Like, what is that something that you saw as an effect, or is it something that's more on the mentorship level?
I mean, yeah, okay. So first one, definitely mentorship level as well. Like there's really good feedback, really honest, sharp feedback that's very valuable, but also they're extremely founder friendly. You may hear that kind of terminology. There are certain VCs out there that are, they focus on certain KPIs, or focus on this and focus on that and burn money fast. So like grow fast so we can go to the next round and just keep that hot potato going. And GC is different. They really just put a lot of trust into the company and the founders. And I really appreciate that. Like they invested for a good reason. They believe in the founders. They believe in the company. They believe the company's building the right thing, and they also believe in the market. And there's a danger in certain VCs trying to oversteer or steering in the wrong way because there's misaligned incentives. And so GC's been fantastic in that regard. And also, what's really great about General Catalyst is they're extremely well connected, especially in the healthcare space. They actually just recently bought a hospital network, and so that's why that's very interesting to us. They are investing heavily in healthcare, and that's obviously right up where we are. So
Going into a quick rapid fire here, what is the biggest myth people have about automated eye testing?
that it's like some sort of like AI robot that does it. In our case, it's actually more like a data collection system. There's software, of course, very complex hardware software that is being used to collect the test measurements. You can call that AI if you want to, that software that does it, or the automation components. But, the word AI has been completely overused at this point. But once the information is collected, it goes to a licensed and educated doctor who then evaluates and does the work they would usually do in their own clinic.
What is the most surprising user reaction you've seen so far using Eyebot?
Well, we have so many stories.
Any specific story that kind of gets you through the
Yeah,
day?
there's one. I'm trying to think if there's one that happened recently that we're very proud about. So there was a nonverbal person who was struggling through social anxiety and many reasons to not being able to go see a doctor. They came in with their parents and were able to get an Eyebot vision test in Walmart. And once that person received the prescription and got the new glasses on the day of pickup, everything went great and the glasses were perfect. And that person ended up hugging, kissing all the folks that were actually there from Eyebot. It was purely by happenstance that Eyebot people were there. And they were so happy that this was even a possibility. And it felt great for us to be able to unlock something so essential and so basic for people.
Yeah. And, as a podcaster, you do a lot of stalking. And, one thing I kind of saw is like, you're from Switzerland. What is like one specific childhood memory that you have from there that gives you good throwbacks, essentially?
I mean, it's a great country, high standard of living. I'm probably the least Swiss person. I grew up in a very alternative way. And so partially living in the United States, partially Switzerland, back and forth. From my childhood, I grew up mostly in Switzerland, so I have a lot of great fond memories. It's a great place. It's beautiful, but it's not, I would say, a place to build something like this. There's only one place in the world where you can build ambitious, crazy things like this, and it's the United States.
Yeah, that's very true.
I
So
will
you
say
have,
though, China in India are both catching up big time,
yeah,
and there's some fantastic startups coming out of China recently
neat.
that are doing and growing exceptionally fast.
Yeah. Yeah, definitely with Europe, with all of the regulations that they have currently, it's definitely much more of a harder kind of setup pull than.
Yes and no. It's actually and ironically, what we're experiencing is that the regulation in Europe is actually more relaxed than the United States.
Mm,
What the difference is the attitude and the money involved in being able to even like the in Europe, it's much harder to get investing money to build something that has high risk of failure. And that is, it's just much more conservative and the attitude is different. And in the United States, it's a career path for students coming out of Stanford or really great, ambitious people from around the country. It's a career path to go work at a startup early on in your career. That's not the case in Europe. In Europe, it's more banking or other services are more alluring. And so you have a lot less good talent and sort of less mobility on fighting talent in Europe than you have in the US. And
Yeah.
the US is just full of talented folks that are willing to move across the country to join your tiny little startup.
Right. Do you recommend people to at least try starting a startup at least once?
100%. I mean, for you or it's not. Like building a startup is that you can't learn in school. I don't want to do anything else in my life.
Yeah. And
I think I'm unemployable at this point.
I mean, so I guess final question, what legacy do you want to leave in the world for your kids, for your grandchildren? Like, what does that look like for you?
I want people to be able to get a pair of glasses and just walk into a place and buy them and walk away with glasses. I would feel pretty good if I could look back and say that I helped make that happen. The
Yeah.
fact that this can happen today is kind of ridiculous.
That'll be amazing. I mean, dude, it's been amazing to have you on the show, and I enjoyed this so much, truly. And I can speak to you for hours. So it was a pure joy to have you, and I truly appreciate this. So thank you.
Yeah, thanks for having me.